First Local News Weekly Report with Colette Linden.
Good evening, I'm Colette Linden, and these are some of the stories from this week. The Ontario government is investing over $2.8 million to ensure continued access to primary care services for families in Sault Ste. Marie. The funding was announced in the 11th hour before 10,000 patients at the Group Health Centre were to be derostered at the end of May. This funding will support a new Group Health Centre outpatient clinic called the Access Care Clinic, ACC, located at 170 East Street in Sault Ste. Marie. The ACC will ensure continued access for up to 11,200 GHC patients who have lost access to their primary care physician on or after May 31st, 2024.
If we go back to ringing in the new year in January, we received some rather challenging news out of the Group Health Centre, and certainly challenging news across our community with respect to the issue of primary care services and generally speaking, the provision of healthcare services within our community. We've been working very closely with the Group Health Centre. We've been working very closely with all of our local healthcare practitioners here in this community to be able to come up with a solution to those first group of rostered patients who were set to be derostered as of this coming Friday. And I'm very pleased to announce that those patients will not be losing access to a primary care provider. The Group Health Centre has been provided funding by the Ministry of Health. I really want to thank our Minister of Health, again, and all those in government for being able to accomplish this. The total funding will be for $2.8 million a year, just shy of $3 million a year, $2.8 million. And that will allow them to operate a nurse practitioner clinic through the Group Health Centre. That clinic will be able to service 11,200 patients.
Recognize that this is not a sustainable or long-term solution. And as already mentioned, it is one step towards our long-term goal. To achieve our goal, we will rely on the continued engagement and support from our MPP and the Ministry of Health to address the primary care challenges in our community. Our focus remains firmly on supporting our providers and recruiting new primary care providers, physicians, and nurse practitioners. We will continue to advocate for resources and innovative solutions to improve primary care access within our community.
Healthcare is a quality of life issue. It it's fundamental to our city being able to market itself as the place to live, and that was all at risk and not very long ago. I mean, up until yesterday, there were stories coming out about what's going to happen on Saturday. I think this puts a lot of minds at ease.
The entire province and across the entire country. This is a common goal for us all, and we're working towards that. I think it's really important to note that the efforts that we have made to date and the collaboration that has been achieved to date is helping us get to that point of being able to recruit more, being able to retain more, and ensure that we continue to work towards building more of a team-based model in healthcare, in the provision of healthcare services. I think that's very important, and I think I speak for everyone when I say that.
Meanwhile, the Ontario Health Coalition held a province-wide rally Thursday, and Sault Ste. Marie was one of the many communities protesting against the Ford government's plan to privatize Ontario's healthcare. Across Ontario, protests to demand a moratorium on the closure of local public hospitals and a stop to privatization of healthcare took place during the noon hour. In Sault Ste. Marie, the protest rally was staged at the Roberta Bondar Pavilion. The Ontario Health Coalition say patients are being charged hundreds or even thousands of dollars in illegal user fees for access to needed medical care.
And we see that, right? We see under pressure is when the government comes to do things. And so here we are standing here. We had 300 people at the last rally at his office, at Ross Romano's office. And now here we are together again today. And you're seeing more folks out here frustrated what's happening in public health care. We need to keep public health care public. People should not be paying to go to a clinic or paying for service. I just heard yesterday that it's up to between $3,000 and $30,000 for people to access mental health and addictions care. I mean, how is that a service that's not covered under OHIP? So, I mean, we need to stand together and have our voices heard, and we need to be loud so that they understand that we're here, and we're here to make a noise, and we're here to get service.
The mayors of the 5 largest cities in Northern Ontario are looking to senior levels of government to join them to address the issue of their growing populations. Sault Mayor Matthew Shoemaker was host of NOLM, Northern Ontario Large Urban Mayors, Monday at the Civic Centre. The NOLM meeting included Shoemaker, Sudbury Mayor Paul Lefebvre, Timmins Mayor Michel Boileau, and North Bay Mayor Peter Cherico. Thunder Bay Mayor Ken Boshkoff joined the meeting via Zoom. Housing and associated issues were dominant topics.
Yes, I think that the efforts will be to really enumerate what those expenses are that we're incurring, and to go to the provincial government and say, you know, these are provincial services. These are historically provincial services that have been essentially downloaded to the municipality. Here's the impact on the budgets in all of our communities. And as northern hubs, you know, we draw in people from Prince Township, for example, from Goulet River, from even further afield up north in Wawa, to, you know, we're kind of a service hub for those areas, and further east to Blind River and Deco Bay and the communities down the line. So there is a pressure put on our municipal services because we are providing services beyond the scope of our boundaries, but we are only being funded by the province for the specific boundaries of our municipality. So
Roberta Bondar Park will see several cruise ship visits throughout the summer and early fall. The ships that come into port will be bringing approximately 3,500 visitors combined to Sault Ste. Marie this season. The ship visits vary from early morning and arrival to late evening departures, depending on the vessel's direction. Before a ship's visit and until departure, Transport Canada outlines security regulations that, as a port facility, the city must adhere to. Ship visits started this weekend, and other cruise lines will dock in June, July, August to the end of September. The City of Sault Ste. Marie is examining traffic efficiency and safety in key areas throughout the city. The review will evaluate several solutions, including signal timing, implementing dynamic signaling protocols during peak hours, and removing traffic signals deemed redundant in specific areas. In a recent assessment of the city's 78 signaled intersections, staff identified 3 primary areas for potential traffic signal removal. These areas are Queen Street East and Church Street, Albert and Elgin Street, and Albert and Dennis. During the trial phase of this project, signals at these intersections will be covered and temporary stop signs will be installed on the minor roads. This study period will enable the city to evaluate the impact on pedestrian and cyclist movement and traffic flow on surrounding side streets. Staff will then review the adjustments, considering safety, efficiency, and cost effectiveness. The summer road construction season is upon us, with several major projects planned. Residents in the East End are being impacted on Stanley Street. A complete redevelopment of that road has already begun, replacing sewers and water lines, along with new roads and curb and sidewalks. The entire road is being replaced from Pine to Elizabeth Street. The project was originally slated for last summer, but budget restraints moved the massive project to this year.
The 101st Rotary Community Day Parade is set to change course this year, running west on Bay Street on Saturday, July 20th. The decision to change routes was necessary due to the Queen Street reconstruction plan, which is scheduled to begin later this month and continue through the summer. Bay Street will remain closed from Lower Pym to Andrew Street to St. Mary's River Drive for the duration of the parade, with limited access to St. Mary's River Drive and Foster Drive. The parade will launch on Bay Street with a new theme this year, Welcome to the Zoo, with the menagerie of cats, cranes, and other construction equipment downtown. Fencing has now gone up on the former General Hospital site. Owner of the property, Italo Ferrari, on behalf of an Ontario numbered company, was forced to install fencing around the property by the city. It's been an ongoing battle between the city and potential developer for years. The General Hospital site has been trashed by vandals despite security being hired by Ferrari. The city asked Ferrari to install security fencing around the property over 1 year ago. The numbered company says it plans on building a long-term bed facility along with riverfront apartments or condos. However, no plans for the development has yet been submitted to the city.
Downtown businesses will soon start feeling a little better about crime in the area, with the addition of old-fashioned boots-on-the-ground security patrols returning to downtown Sault Ste. Marie. The move was approved by City Council earlier this year. The patrollers will initially walk Green Street from 11 to 3 p.m. and 6 p.m. to 10 p.m. 7 days a week, although those hours will be subject to change. We caught up with a few downtown merchants about the initiative.
You know, we're very happy that they're bringing back the patrols, especially going into the summer months. As far as I know, it's going to be going until the end of the year, which is great. From what I've heard, it'll be two shifts in the daytime, and we're looking to have that start probably end of June or July.
We think it would be a positive thing. It helps us with the security of our store. We've had some damage done sometimes, or sometimes things that are unsafe left about. So it would be nice to have for that aspect from our perspective. And then sometimes some of the people that are on Queen Street, sometimes they need some help or assistance.
We are really happy with them coming back. They were really helpful last time that they were like patrolling the streets. So I think it's a good addition to downtown, and it will be helpful.
Police officers, they come into the businesses. If you have any concerns, you can ask them at that time. It cuts back on a lot of things happening on the street that shouldn't be happening.
I think that for both customer and general public trust for downtown consumers, daytime patrol would probably be better. But then if we were to look at things specifically like vandalism or break-ins, I mean, most of the issues that we have had here have been overnight.
So bringing this back, we're hoping that it will bring us back to a little more secure and some peace of mind as well for shoppers and business owners and the patrons of downtown.
2 people are recovering after 2 serious dog attacks east of the city. On May 25th, shortly after 5 p.m., Sault Ste. Marie detachment of the OPP, with the assistance from Batchewana First Nation Police Service, responded to an animal complaint on Nebish Road in Laird Township. Algoma paramedic services were on scene prior to police arrival and were attending a victim with multiple dog bite wounds. This victim was operating a bicycle on Nebish Road when they were attacked by 2 dogs and sustained injuries to their left and right buttock, hip, as well as several punctures to the left forearm, road rash to both knees, and was later transported to hospital in Richards Landing. In a separate incident that also took place on May 25th, another person who was riding a bicycle on Nebish Road was approaching the property and observed 2 dogs running aggressively towards them. The victim was attacked and fell to the ground. The victim fought the dogs off and ran across the roadway, where again he was attacked. Police later located the victim at their residence with significant dog bite injuries to their right arm, bicep, triceps, and right buttock. The victim was also transported to hospital in Richards Landing via Algoma paramedic services for medical treatment. As a result, the dog owner, Nelson Alves, 40 years of age from Laird Township, was charged on May the 28th with failure to prevent a dog from biting, attacking a person or domestic animal. June is Hydrocephalus and Spina Bifida Awareness Month. Troy's Trail Spirit Walk is a community event established in 2012. The annual event brings awareness to the disease as well as fundraise for the Ontario chapter. Troy Chandler and his wife created the event and staged the walk each June. Troy and Annette will join me in the studio to talk about Walk this year later in the show. We have more news coming up, but first, here's a look at this week's weather.
The First Local Weekly Report is made possible with the support of these community-minded sponsors. The Medicine Shop, offering professional and confidential pharmacy services. The Medicine Shop, 59 Great Northern Road. Arch, the Algoma Residential Community Hospice, 229 4th Line West. Get your tickets for the monthly 50-50 raffle. When you help hospice, everyone wins. Canadian Tire, made for life in Canada, 200 McNabb Street, Sault Ste. Marie.
Sault Ste. Marie, Michigan City Manager Brian Chapman announced that the city's 2024 Independence Day fireworks will be held over the St. Mary's River near the east end of the Sioux Locks. The fireworks will be launched at dusk on Thursday, July the 4th. Last year, the fireworks were moved to Sanderson Field Airport after the Army Corps of Engineers said the equipment, materials, and fuel used for construction at the locks made that area a safety and liability issue.
Welcome back. As promised, I am joined by Troy and Annette Chandler from Troy's Trail Spirit Walk. Welcome to the show.
Good, how are you?
I'm very well, thank you.
Excellent.
It's great to see you again. This is the third meeting that I've had with Troy and Annette, who we did say would be here and is here, but not officially in front of the camera. So just wanted to correct that one. But tell us about this 13th annual walk that's coming up on June the 8th.
Yep, we're very excited. We've been full steam ahead. The event will be happening in front of the Art Gallery
Nice.
down by Clerg Park. We've kept that site right from the get-go.
Yeah.
We started in 2012, and this will be our 13th walk.
Yeah, lucky 13.
Yep, we're very excited about it. That seems to be all coming together, and
Good.
just hoping for a good turnout and
Right.
people to come out. And
So let's talk a little bit about the walk and why you're doing it.
all those in the Siouan area who have either or both hydrocephalus and spina bifida. It's a walk for support. Like when I was diagnosed, Annette and I didn't have any support. We couldn't find any support. We went years without any.
Yeah.
And we finally found a way that we reached out to Hydrocephalus Canada, and we found a way to create support.
Yeah.
And the way to create support was they said they do these walks in different cities throughout Canada, and we said, why not?
Yeah. It's all that money that's raised goes towards, well, it helps with awareness, obviously.
Absolutely, the awareness is huge because we always want to reach people. We don't want people to be alone going through this. You shouldn't have to be alone going through this.
And on that subject, actually, how rare is the disease? That there wasn't anything before, because we know other months, there's cystic fibrosis and we have our cancer walks, but how rare is it?
It's popping up more and more, unfortunately. Spina bifida, with what the awareness we know now with folic acid, spina bifida is on the decline, which is such a good thing. But hydrocephalus is popping up all the time. I don't know why the reason is for it, but it's becoming more
prevalent.
Yes, and we know about it, like through science and everything. We know more about it now, so we can pinpoint a thing to it.
Which has helped with the awareness and money towards funding any resources.
Absolutely.
Okay, so that's how important this walk is on June the 8th. Tell me a little bit more about hydrocephalus.
Hydrocephalus itself, it's otherwise known as water on the brain. Excess cerebral fluid. Your body's always creating this cerebral fluid to help cushion your brain. And then excess just drains out of your body naturally. And hydrocephalus occurs when the fluid can't drain out of your body, and it's just building up inside the ventricles in your brain. So they go in and they put a shunt in through the back of your head with a tube down and drains into your stomach, and it drains the fluid naturally for you.
And you've been experiencing, this is something you've had?
I have had that done. Most people do. And you wish it was foolproof, but it's not, because you do have complications. I've had 10 shunt revisions. I had 10 shunt revisions in 10 brain surgery shunt revisions in 7 years. Went through a rough patch, and lots of people go through rough patches like that, some worse than me. A little girl in our group, Jessie, terrible what she's gone through. And then other people from birth right through just can keep going.
Really?
Yep, and it doesn't just happen at birth, it happens at all ages. We've met people in our group where it's happened in their 60s, they've got diagnosed in their 60s.
Oh, that's okay.
Yeah, you can be born with it, you can develop it later on, and that's what happened. I developed it later on.
Okay. Was there anything that brought it out, the doctor's pinpoint from that, or is it just, like you said, it's just how your body handles it?
I had symptoms through school, and it just went undetected and undiagnosed until the pressure got too much.
Well, it's so important that you're here today with us again. And again, this is the third time I get to interview with you, so I'm really happy that you're here and sharing this.
Thank you. I really appreciate it.
Thanks. But this 13th annual walk is so important to raise awareness and to build funds to further research.
Absolutely. Hydrocephalus Canada really needs the funds for the research and development. They want people with these conditions to live their best life possible.
Yeah,
So
absolutely.
they're always doing research and development and trying to figure out ways to do that.
That's
They're a
great.
fantastic organization.
I have one quick question for you. I
Sure.
know when I first had my children that they would take the prick test of their heel, and cystic fibrosis at one time was not tested for. Is this something that perhaps, early detection, there might be help if they can include that as part of a measure?
Well, they do, like it would be detected in the womb.
Oh,
they
okay.
they actually do surgeries pre-birth
Wow.
and can do stuff because they'll recognize it right away. If it's something happening right at birth in the fetus stage, they can recognize it right away and plan an attack against it.
Wow, that's how important this walk is. So let's talk about the details before we have to end the interview. When is it again? Where is it? What time? And how can we donate?
Okay, the walk will be Saturday, June the 8th, right in front of the art gallery. Rain or shine, because the art gallery has agreed if the weather's not good, we can go in there. They've got a little room in there we can use.
Oh, great.
So it's going to happen regardless. And
What time?
it's registration starts at 11 o'clock, and we're hoping the walk to start around 11:30.
Okay. And can we donate prior to the
Yep,
date?
yep. You can just contact Annette or I through our phone number,
Okay.
705-946-4532, or through an email at hydro.troy@gmail.com.
Okay.
And yeah, we can answer all your questions. Yeah.
Okay, great,
So,
great.
yeah.
All right, so you've heard it, Sault Ste. Marie. That's where we need to be to help raise funds on this very important day. Thanks for being here, Troy. I really
Thanks
appreciate
for having
it.
us. Thanks for having us. We're very excited. We're looking forward to seeing people and reuniting with people again because this is our one day that we get together and talk throughout the year.
Yeah.
But this is the one day where we just get to let our guards down and just celebrate us
Yeah,
being together. Yeah.
That's a really cool way to approach it.
Yeah.
And by the way, Annette, we will see you there. She will be there.
Absolutely.
Thanks for being here.
Thank you so much. Appreciate it.
Again, Troy's Trail Spirit Walk is June 8th on the waterfront. We have more. Don't go away. We'll be right back after this.
The First Local Weekly Report is made possible with the support of these community-minded sponsors. Canadian Tire, made for life in Canada, 200 McNabb Street, Sault Ste. Marie. The Medicine Shop, offering professional and confidential pharmacy services. The Medicine Shop, 59 Great Northern Road. Arch, the Algoma Residential Community Hospice, 229 4th Line West.
Welcome back. Finally tonight, we all know how quickly the summer season can go by here in Sault Ste. Marie, and already 2 keystone events have come and gone for this season. The Pee-wee Midway wrapped up their annual Victoria Week Carnival. This was the 50th year that Campbell Amusements rolled into town with a number of amusement rides, games of chance, and of course, Carnival Eves. The Midway is one of the biggest fundraisers for the Pee-wee Arena to help maintain operations. Meanwhile, the Great Benjamin Circus entertained hundreds last weekend. The circus, with its big top, was set up on the western parking lot of the Station Mall for 4 days last week. The circus featured acrobats and clowns. Great Benjamin Circus and its caravans traveled to the 4 corners of North America, from Florida to California, Alaska to Newfoundland, Labrador. That's the show for this week. I'm Colette Linden. For everyone here at First Local News, have a great week, and we will see you next week.